Hi, I want to share some information today about a problem called CDS or cognitive dysfunction syndrome, or you can call it Dog's-Alzheimer's or Alzheimer's if you like. So this is a relatively newish disease, and we're seeing more and more of it all the time because dogs are living longer. And previously they didn't get to live long enough to get dementia, and now they do. And so we're seeing about 50% of dogs over 15 will have some signs of CDS or dementia, and probably about 13 or 14% of dogs over 10 or 11. So this is Maddie. She's one of my rescues. She's about 10 years of age. She's a Maltese. She has rotten teeth. I have to clean her teeth twice a year. She has Cushing's disease, and recently she started, which is under treatment and under control, and then recently she started showing signs of CDS or dementia. Now, the common signs that we see are dogs not interacting with the family like they used to, staring into space, getting caught underneath furniture, getting caught in the corner of a room, strange things like that. Awake at night, asleep during the day. A whole heap of subtle, slight changes are a good way to recognise dementia. Now, dementia in dogs runs the same course as people. It gets progressively worse. Excuse me, I just trimmed a little bit of hair from her, and I've got it around my nose. And the other thing about dementia is that there are things that we can use to treat it. There are quite a number of drugs available, 3 really good ones, and then there's a whole heap of non-drug type medications, and that's what I want to talk to you about today, because that's what I've been using on Maddie, and that's what's been working really well. So the first thing is if you recognise signs of dementia in your dog, really you should come in to see me, and we can go through some of the treatments that are available. But I'm just going to give you a shopping list of treatments today. Obviously can't recommend that you use them yourself without seeing me or seeing a veterinary professional, but I thought you might find some of these interesting. So these are non-drug treatments for CDS in dogs. Now the first one is milk thistle. So milk thistle is a milk, it's an action, we use the extract of milk thistle. It's a supplement. You can buy it online. You can buy it on health food stores, and it has an absolutely brilliant safety record. It has no side effects. It doesn't interact with any other drugs, and we also use it for liver disease, and it works very well for those. Now, we typically use about 150 milligram for 10 kilos, something in that area, and it typically comes as a capsule, and we would give half a dose morning and night, or a third of a dose 3 times a day. Now, too high a dose can cause tummy upsets, gas, and mild diarrhea. Now, milk thistle is a great drug to use for CDS, and we often mix it with another drug called ginkgo. Ginkgo is another drug that you can get, or a non-drug drug, if you want to put it that way, a natural remedy that you can get from a pharmacist, you can get online, you can get it from a health food store. And we'll often use ginkgo together with milk thistle, and then we'll also use medium chain triglycerides. So we've got short chain triglycerides, medium chain triglycerides, and long chain triglycerides. We want to use the medium chain triglycerides. If I put her down, she's going to run away. She's an escape artist. Now, the most common and easiest to get medium chain triglyceride is coconut oil. And so Maddie's on those 3 things in the appropriate doses, and they've worked really well on her. Now, the only downside to coconut oil is that it does put on weight. It is an oil, so you just got to be careful that you cut some of the other calorie intake, dry food back or canned food back. Now, as well as that, things that help with CDS is arginine. Arginine is an essential amino acid, so typically I'll throw dogs with CDS on a really good multivitamin and ensure that it has arginine in it, as I said, a good quality multivitamin, and then also we'll add some fish oil in as well. So in about 30 days on that mixture, most dogs with CDS, I'm finding about 80% of CDS dogs will show an improvement and then maintain that improvement. The earlier you start it, the better it works and the longer it'll work for. So if you've got a dog with CDS, come in and see me. Alternatively, I've written a handout on it, which is what I've been sort of referring to while we've been talking. I'm only too happy to email that to you, or you can come into the clinic and pick it up. So hope this has been an interesting story. I'm sure that now that you've heard about CDS, as you go around, you'll see plenty of dogs with CDS symptoms. They're quite common. So see you on the next video.